This meeting is being recorded.
Okay, great. All right. So my name's Rima Naresh. If we haven't met, I'm an engagement advisor with Help Consumers Queensland, and I am going to be facilitating today's training with wonderful Michelle King. Michelle, give a big wave to everyone. She's one of our consumer presenters for this series. I want to start our session today by acknowledging country. I want to acknowledge and pay my respects to all the different lands we're calling in from. I'm calling in from Turrbal country, and I want to pay my respects to elders past, present, and emerging. And if there are any First Nations people here on our call today, I warmly welcome you and acknowledge that you have joined us today to participate in this session. So thank you very much. It is also part of my culture to acknowledge each one of you here today as well. I want to acknowledge the work that you do and the lived experience that all of you bring from your lived experience and from your culture and from your ancestors as well. I think all of us who do this work have histories and contributions, and as we discussed last week, each part of us becomes valuable in this consumer rep work. So welcome to session 2, and I might throw the ball over to Michelle for her to do a quick intro of herself. So Michelle, over to you.
Hi everyone, sorry, I'm just madly texting, trying to follow up something with one of my kids. I'm sure we can all relate at this time of day. It's like, hi and welcome everyone. My name's Michelle, and I've been involved with Health Consumers Queensland for a couple of years now, I think. And I guess my background is, as a consumer, is that not only for myself, but I have a daughter with profound and multiple disabilities who's now 23, and we're frequent flyers in the health system. And I also have, I guess, a professional hat. I am a lawyer and sociologist who works on transition to adulthood for people with impaired capacity. So I look at how people with impairments to their legal capacity move through the various administrative systems like Centrelink, banking systems, voting, and the NDIS, including the health system. So I have two directions that I like to think intersect quite nicely, and how I ended up in this area was due to my lived experience. So I sit on a number of national, state, and local networks as a consumer. So yeah, looking forward to getting to know you a bit more over this session and sharing a little bit of my own experience being a consumer in various roles, and some tidbits on how to negotiate quite a complex health system. Back to you, Rima. You're on mute, Rima. Sorry.
Amateur mistake. Thank you.
There you go.
How we will run things today is, if you can have your videos on, that's wonderful. Please try to keep yourself on mute unless you're speaking. Sessions for an hour. We have a lot to share today. If you're not a member already of our network, please join it. I've popped the registration form in the link in the chat thread. I'm feeling really rushed because I'm so excited. There's so much content we want to share. I was looking through it today, and so I'm kind of already struggling over my words. If you have questions, please put your hand up physically like this. It's a lot quicker and easier for me, or you can raise it electronically as well. Happy to answer them during the session, and also we will try to allow time for it at the end. May I
It went back on mute, Rima.
Oh, that's strange. May I please respectfully request your permission if someone is sharing online and it goes off topic, that I bring you back by interrupting you? Is that okay with everybody if I do that? Yeah? Okay. I'll do it as kindly and compassionately as possible. All right, so I'm going to do a screen share and then we will kick off. Share. So, Alexandra, can you see a maroon screen? Big thumbs up, awesome. Okay, great. Okay, so who's seen this document before? Charter of Healthcare Rights. I'm not seeing any hands up. Tanya has, Kate has, Jelly has. That's great. That's great. Does anybody want to share what they think it might be? Kate, do you want to tell us what it is?
Okay, so this is the Charter of Healthcare Rights, and it, as it says, it describes what anybody using health services can expect from an Australian health service. It's produced by the Australian Commission for Quality and Safety in Healthcare, and it's part of the healthcare standards, Australian healthcare standards.
Wonderful. Thank you so much. See, half of my job got done when I asked for audience participation. So the bit that I'd add in there is, so it's for people or people who care for people who need healthcare. So consumers and carers, yeah? So it's interesting use of language like we talked about last week. So patients, carers of patients, consumers or carers. Yeah, so the charter basically summarizes our basic rights of what we can expect. And, you know, this applies in the public system, it applies in the private system, it applies for day procedures, general practice and community health services as well. So anywhere that you get healthcare. Yeah, and the rights as they are there is around access. So you have a right to use healthcare services and receive treatment when you need it. There's the one around safety is about you have a right to be cared in a place that is safe and that makes you feel safe. Yeah, and then respect is all around the health service organization should recognize and respect your culture, identity, and beliefs. And when we're talking about partnerships, it's around sharing information with your clinician for your own care, so that it helps them provide care for you as well. So you're partnering in your own care. And then when it's about information, it's about you having the right to ask for information if you don't understand anything, asking for clarification. And you also have a right to bring someone with you to appointments so that they can support you and help you with your understanding. And then when it comes to privacy, it's around dignity and respect there as well, but also your information being private, so record keeping and all of those things. The one that I gives a big clue around consumer partnerships is the one about giving feedback. So you have a right to provide feedback or make a complaint. So when it comes to receiving care, sometimes things don't quite go the way they did, and so you would want to give feedback about it. Or that everything went brilliantly and you want to let somebody know you did a great job. And so being able to give feedback gives you a clue around consumer partnerships. So consumer partnerships is that opportunity where you are giving feedback. And it's not just about, and I'm wondering if someone can remember the words I use. So as a consumer or a patient, you're receiving care, but as a consumer representative, what are you doing? Who remembers that word that I used last week? Should I ask somebody? Check if you're listening. Okay, so it's around, okay, Sangeeta is mouthing something. So it's about influencing care, yeah? So one is about receiving care and one is about influencing care. So as a patient or a consumer, you have a right to give feedback and partner with your care. As a consumer representative, you give feedback and you partner with health systems to change the way care is delivered. With me? Yes? Excellent. Michelle, do you want to add anything to that? She's saying no. Okay.
No, I'm all good.
You're all good. Okay. So jump in. Whenever I see you go off mute, I'll know that you want to speak. So this next page, I'm not going to say much about it other than to say that these links are available to you to access resources that I think would be really useful. I collated these for you today because they give you extra information. So you don't have to write this down. You will be emailed this document and you'll be able to click on it and you'll be able to access these documents. They're documents that have been prepared by, and I think Kate said the commission. And if you look right at the bottom, it's the Australian Commission on Safety and Quality in Healthcare. So this is something that we would all encourage you to go and explore, that very gigantic website, and you want to look up something. So this is the bit you want to write. Standard 2, you want to go look up something called Standard 2. And we'll talk more about that in other trainings, but I'm just giving you clues about some things that you need to know about later on. Okay, so what we'll do here is we won't go into breakout rooms as we had planned, but what I would like is a little bit of audience participation now. So I'd like to hear from you around what some of you think the health system might be. Maybe you can tell us some names of different parts of them, maybe the different people, the players of who they might be. So yeah, if some of you could put your hand up, I'd love to invite you rather than me. Jelly, go ahead.
Hello. In terms of outpatient or community treatment, that would include places like KIMS and the other kind of adult or acute teams that work with people in the community. And yeah.
Nice, thank you. So Jelly's gone into speaking about a very specific area of healthcare in terms of mental health. So she's outlined those. Cheryl and then Alexandra.
Sorry, I'll unmute. Hi, everyone.
Hi.
My understanding of the health system would be any part of the hospital system or even allied health. So if you were going to a hospital, whether you're going to be an inpatient for an operation or you're going to the outpatients, that would all fit under the health system. All the doctors, nurses, etc., would be under that system as well.
Thank you. Okay, so you've identified being an inpatient and an outpatient, and some of the players are the doctors and nurses. Alexander and then Jason.
Is that me?
So Alexandra Owens.
Yep, that's me, sorry. How I would understand the health system as is both in the public and private sector, like you mentioned before. So not only run by hospitals, but also those who run out of clinics, GPs, or remote and rural health that can admit patients for overnight or long-term treatment, or those who come in for a day for that one-on-one treatment. So I would say that that would cover also the different parts of the health system, but also the different players in the health system. So not only having some family members who actually work within the Department of Health and have decided to go down the nursing route, and myself being part as the administrative team for Queensland Health. So whilst one role is more clinical than the other, we all play a part in making sure that we deliver client-centered care and also quality healthcare.
Great, thank you. So some interesting differentiations there around, so we heard Department of Health, we heard clinical and administrative staff. We've also seen the chat thread here that someone's talking about peer workforce and independent patient rights advisors. So these are all really important roles in the health system as well. Okay, so we're going to go to Jacine and then Kate, and then we're going to wrap it up there, and then we're going to move on.
Hi, everyone. So my understanding of the health system is like, GPs, private and public health sector, all the departments within the hospital system, also allied health on the outer, seen as we have a patient and wellness model of care. Then you have all the complaints processes, so APRA, OHO, all of that's part of that health system network as well.
Fantastic. That was the next few of my slides. I was trying to pull them up straight away as you were talking. And then Kate.
Hi, everyone. So I'm in the ACT and we talk about it in terms of primary healthcare and secondary and tertiary healthcare. So primary healthcare being your doctor, your local GP, and that thinking about them as kind of like the gateway to lots of the other kinds of services and options that you might have, like hospital care or community care or specialists. And here we go, here's a nice slide that looks at it. So I'll stop talking now and let Rima.
I was just pulling that slide up for you because you were talking.
Oh, okay, well, there we go. So I can talk to it. And just to let you know as well, I'm in a consumer organisation here in the ACT. I'm a staff member. So secondary care being, we think of those as the kind of hospital care, but the smaller sorts of hospitals that can do a lot of the basic kind of healthcare, but not so much the specialist care. Here in the ACT, we have one tertiary hospital that can do some of those specialist procedures. And then again, once you're discharged from some of those other kinds of care, you're back to your GP to sort of oversee your treatment and help you manage the whole complexity and the big picture and the different parts of your care.
Great, thank you, Kate. Awesome. Well, thank you, everybody. So that was a really lovely summary there. So I'm going to have to request people who have put their hands up if they can figure out how to put their hands down, because I don't seem to have control over that. I've lost a lot of my powers. All right, so when we talk about, so this is great. So we've had a bit of a view from the Canberra angle, and then we've talked about what our experience has been with the health system. So I'm going to pull right back and talk about the Australian health system, and then we're going to dive into Queensland health, because that's the health system that we're going to be working in. So in terms of the Australian health system, what we can say about it, and if anyone, and most of you have dabbled in this receiving care or navigating your consumer rep work, the word is complex, isn't it? Complex, really difficult to navigate. Okay, lots of nods over there. But you know what? It's a really good public health system. For someone like myself who is not from Australia, we have a great health system here in Queensland. My son had an open heart surgery 3 years ago, and had we not been in Australia, he wouldn't have just gone to Muay Thai right now and then lifting weights. He would have been very unwell and maybe would have had a heart injury. But that was picked up early enough by our primary care provider, our GP, and he made a referral to for us to go and get a scan done. And then we were back in his office the next day, and he made a referral to a secondary healthcare facility. So by that we mean a hospital like Prince Charles Hospital in the north side. In fact, Prince Charles Hospital is also a tertiary care provider, meaning it's a specialist place. So in terms of cardiac care, it's one of the top teaching hospitals. But because my son was only 17 at that time, 16, and that was an adult hospital, he got referred to Children's Health. So that again is tertiary care. And then once the surgery was over, he got referred back to our GP again. And so then the cycle got complete. Can everybody see how we've journeyed through the health system? Yeah? All right, good. We're going to go backwards again. So in terms of the Australian, in the way that the health system is, the care is delivered, it's a mixture of state-based and nationally, so Commonwealth. So there's different buckets of money. And the reason why I'm sharing this with you now is because it'll it's really important for you when you begin to do consumer rep work is to understand the terrain you're navigating in. So to understand the big picture view and then the state view, and then to understand your own local view. Yes, I'm diving it through different layers for you so that you get that picture. Does that make sense? Yeah, a few nods. Okay, good. So most of the work that HCQ does is focused on health service delivery. Yeah. However, as a consumer representative, you can be involved in all aspects of health. So if you look on the right-hand corner, there's a green square. So, and I think Jacine and a few other people actually mentioned some of these different ones. So there's regulation of health professionals. That's also an organization that you could be contributing in. So this would be what they call APRA, which is another acronym, but it stands for Australian Health Practitioners Regulation Agency. Yeah, there's a lot of accreditation facilities. So the commission that Kate mentioned earlier, and then there's a lot of education and research facilities. So these would be medical research institutes as well as universities. And there's a lot of consumers getting involved in research these days. It's also a very big emerging area. There's also complaint systems like APRA. So these, and OHO, which is the Office of the Health Ombudsman, the Medical Board. So all of these organizations also have consumers involved in their work. So you can get involved at your local hospital, at your local health service, or you could be involved at a university, you could be involved in one of the national bodies. So I just want you to get a bit of an idea that your scope and areas you can work in is wide and far-reaching. With me? Some thumbs ups? Okay, good, good. Okay, so a little bit about Queensland Health. And Michelle, if you have a story or anything linked to this that tells this a lot easier and more succinct than I would, please jump in. So Queensland Health. So when we talk about every state has their own way of doing health. So here in Queensland, we have the Minister for Health, so right at the top, yep. And then, and I think it was Jacine who said Department of Health, which is like the umbrella. And then underneath it sits 16 hospital and health services. Yeah, so 16 hospital and health services. So Jelly and Alexandra, you're all linked with the Sunshine Coast Hospital and Health Service. Yeah, and I think Sangeeta, you might be from the Gold Coast Hospital and Health Service. But then within Sunshine Coast Hospital and Health Service, there are different hospitals. Yeah. So the different hospitals. Who over here is from Metro South? Stefan, can you tell me a name of one of the hospitals that you know that Metro South has?
Logan, Bow Desert.
Yes, yes, very good. Thank you.
Princess Alexander.
Yes, great. So can you see that? So you have the Department of Health, which kind of oversees and does all of the policy work. And then you pick any one of these 16 here, and we can dive deeper into that. So Stephen Jones is linked or knows about the Metro South Hospital and Health Service. I'm looking over here because that's where my screen is. But you can see that there's a number of hospitals here, everything in orange. So they're the number of hospitals. So as a consumer representative, if you live near Logan Hospital, you can just get involved in that hospital. Or you might say, oh, actually, I want to work at the Metro South level. That'll influence all of the hospital and health services. Or you could say, well, actually, I want to work in a space where it'll impact all 16 health services. So you might decide to do something. Can you see my mouse moving, Brianna? Great. So you can become a consumer representative in the Department of Health. Yeah, so the Department of Health looks like this. So these diagrams look a bit complex. I've just put them there so it gives you a visual. I'm a visual person, so I want to see a picture, but you don't have to worry about understanding it too much. But just to know that there's the Minister, the Department of Health, and then the 16 hospital and health service, and then you pick whichever one you're at. So with the department, you can see that all the hospital and health services are listed here on the right. And then there's all these different areas of work within there. And there's consumers involved at all of those in some shape or form. We'd like.
Sorry, Rima, I was just going to give a couple of examples if that's okay.
Please go ahead.
Just because of the way that it fits together can be a bit complex, particularly when you're just starting out in consumer work and you're not from the health system already. Actually, can you pop back to the Queensland Health Organisational Structure slide for me, Rima? Thank you. I was just going to talk a little bit about that. One of the subnetworks that I sit on is at the policy level inside the Department of Health and sits underneath, in very small writing, you might be able to see there, the Clinical Excellence Queensland. Underneath there, because bureaucracies love more groups to meet, there are a number of clinical subnetworks, and I'm a consumer representative on the child and adolescent and young adult subnetwork of a network that sits underneath the Clinical Excellence Network for Children and Young People. So it's quite complicated because I sit on the AYA subnetwork of the Queensland Child and Youth Clinical Network, which is underneath the Clinical Excellence, kind of sits underneath there. But they have 2 consumer reps on that, and I've been involved with them for about 18 months. And yeah, it's a really welcoming, it's a big group of practitioners, doctors, allied health, nurses, a lot of people from rural and remote areas all over Queensland. And one of the bits of work that we all did was develop a new optimising healthcare for adolescents and young adults strategy, which is being released, I think, next week. So that was kind of one of the ways that you almost sit on top of all of the different hospitals. In one of my other roles, I do research and consumer network for STARS, which is the surgical and rehab hospital in Metro North. So that's connected to a particular hospital in the Metro North area. And that's involved in letting they meet, well, they hope to meet every couple of months, and you advise some of their researchers on projects that they might be doing and that they want consumers to give feedback onto. So that's kind of it's like a higher level one and then a local one that kind of ties together, and you can have all kinds of different roles inside, whether it's policy, giving feedback to doctors and special policy and strategy groups, getting involved in local initiatives about particular issues of health that matter to you, like maternity care or rehabilitation. So it's just such a huge range, and really you go where your interest takes you. So.
Do you have any roles, Michelle, that you play that might be sort of linked to Medicare or GPS? Sorry, not GPS.
Yeah, I
NDIS, PHN, because
not directly, but I sit on I guess at the federal level, because one of the big complexities in healthcare is that your GP is paid federally usually, but your hospitals are managed by the state. So there's quite a lot of complex, it's like a duck on the water, the feet are going madly underneath. And that can mean that if you get involved with primary health, with like with a GP network, that isn't necessarily covered under the state system. You might be sitting on something quite local, or you might be sitting on something national. I'm not involved with primary health in that sense, but I sit on the national COVID-19 guideline task force. So that was a federal level that did that, and we do all of the guidelines for treatment for COVID-19, and they have a consumer panel which is made up of, I think there's 12 of us now, and we advise on, so the doctors do all the research and put the advice together. It goes to their main panel to approve, and then it goes to the consumers, and we have a little bit of advice on all of the national COVID-19 guidelines, and anyone can go and look those up. It's, if you just type in National COVID-19 Task Force, you'll get through to their site, and you can actually look at all the different drugs and all the different methods of healthcare and the current guidelines that are done by a national body. And they've had a very strong consumer commitment to implementing that. So that's kind of at the federal level because of all the COVID funding was at that level. Is that what you mean, Rima? I hope that's
no, that's perfect.
Yeah.
Thank you. And, Michelle has begun to speak about this slide. So we're just going to talk about this, move forward, and then we'll move backwards again. So I think it's really great examples that Michelle has given. So very roughly speaking, and there are exceptions to this, it's really good idea for you to have a little bit of, you know, clue around that there's different buckets of money. So as Michelle said, that in terms of primary healthcare, the GP space, it's managed at a federal level, Commonwealth or Australian government, 3 different names. There's an organisation called PHN. So there are different footprints of different PHNs, just like you have the Hospital and Health Service for Metro North, Metro South, Cairns, Mackay. So along that, there are primary health networks, PHNs, that have similar footprints. Unfortunately, it's not exactly the same as the hospital and health services, but very similar. So we have one here in the north side, south side, every part of Queensland has it. And they do a lot of work in commissioning services and taking care of the GP land. And if you're interested in that space of work, then PHNs have consumer advisory groups and consumers. So I encourage you to get in touch with your local one. Yeah. So a lot of allied health happens in the primary care as well. And someone mentioned that earlier. And often this is funded by consumers themselves, either from their pocket or as part of their private health insurance. So things like getting physiotherapy and similar services like that. People sometimes have to pay out of their pocket. Or I guess then if you come through the public system, then there's different pathways to that. So when we talk about the secondary and tertiary, this is funded by Queensland government through state-based hospital systems, and it also includes private hospital systems as well. But in saying that, there's also federally funded things within the hospital systems as well. So that's why I said very roughly speaking, because there are exceptions to the rule. So knowing who is responsible for these services or these buckets of money that fund these services gives us, would give you an idea about your scope of work and your level of influence. It's really nice to have knowledge which allows you to speak from a real space of confidence. Yeah, so we like to share this bit with you. So I'm going to go backwards a little bit. So quite a lot of this we've covered. I think we're going to skip all of that and come over here. Kate and Michelle covered this beautifully. So the bit that I want to highlight over here is Health Consumers Queensland's work is in this space. Yeah, so when the work that we're funded to do, we're supporting consumer partnerships within, I'll go backwards one screen. So within the Department of Health here and within all of these hospital and health systems. Yeah. So these are all your tertiary and your secondary health services and hospitals in here, alongside all of the administrative staff of those health services and then the Department of Health. Have I completely confused you, or have I got some of you with me still? I have a question. Yes, Sangeeta. You got to unmute yourself, dear.
Sorry about that, Rima. I was a little bit confused. Who funds the primary health networks?
The Commonwealth Government.
Okay, thank you.
So Michelle had said that that is federally funded. So we've, all of us, between Kate, myself, and Michelle, and a few other people, we've used 3 words to describe the same thing: Commonwealth, Australian government, and federal government.
Yep.
Same thing, all 3.
Yeah.
Welcome to the world of crazy acronyms. And
I think a good way to remember is if it's paid for by Medicare, then it's Australian federal government. So
there you go.
So bits and pieces. So if you see a doctor inside a hospital, some of that will be covered from Medicare, but the facility itself and all the systems that run that hospital are Queensland based.
That confused me a little bit, Michelle, because
I'm sorry, Sangeeta.
because my husband had his treatment at the hospital, Gold Coast University Hospital, but that is all covered by the Medicare system.
Yes.
So
but the
that
hospital itself is run by the state.
Yeah, so that is confusing then.
So the Medicare then pays the doctor and whatever they fund through Medicare for the operational service that you're getting.
Sorry, so the federal government paid the university hospital for the treatment that a consumer has.
Basically, yeah. They pay an amount of it if it's fully public funded. Like my daughter's had most of her surgeries either through the Children's Hospital, which is public, or at the Royal Brisbane. And, you know, she has public specialists because she's very complex, and that's a really good way at a big tertiary hospital to get the people who are up on the current research and in complex care. So we do nearly all of her treatment through the public system, but the hospital itself that we go to, like the Children's Hospital and the Royal Brisbane Hospital, are built and run and paid for by the Queensland government.
Okay.
Yeah.
Thank you, Michelle.
It's very complicated, and it's a bit it seems not the most efficient way sometimes when you think about it, but it is what we've got, I think.
It's a good system at the end of the day. As Rima was saying earlier, it's like very grateful to have been looked after that well with his stem cell transplant and everything through the cancer. Is like, really grateful.
And I think let's not get hung up on the funding part of it, but as you begin to do more consumer work, you will remember this and go, that makes a bit more sense. So just take it in and kind of go, oh my God, that's really weird and confusing, and just park it at the back of your mind. Because as and when you start getting involved, you will hear stuff say, oh, there's no budget for it, or the funding ran out, or we have to submit a proposal for that funding, and you'll start hearing those words. So just keep it, just hold it there for a moment. Yeah. So a few other things I want to share with you. So I deliver some trainings with another consumer, and his name is Phil Carswell, and some of you might have met him in the fundamentals of consumer partnership session. And this is something that he speaks a lot about, and I wanted to share with you. He talks a lot about the importance of self-responsibility and self-awareness about taking charge of our own health and well-being. And he says that whilst the government and different systems, state systems, whatnot, fund for healthcare for us, he also says that as consumers, it's our responsibility to get as much education and do what we can to find out more information about how we can take care of ourselves as well. So I shared this here because in as much as we can do about our own health and well-being, of things that are preventable or things that we can influence. So it could be any number of things. I'm not going to even begin to name them, but preventative health is a very big area. And this organization right here, Health and Wellbeing Queensland, has lots of interesting information. So I encourage you to have a look at that. Now, here is a bit of a glimpse, and I think somebody in the group mentioned some of these spaces. So these are all the many, many different pieces of the health system that are not quite neatly fitting into the state or the federal or this way, but they're all linked to us. So, you know, we got asked to go and get scans done. We had to get blood tests done. Then we were asked to get some physiotherapy done. And so we accessed any number of these health organizations. And all of them also have consumers working with them in doing the work that they do. So If you decided that now don't want to be within the hospital and health service or the government area, quite a lot of these organizations are NGOs like us, and they also involve consumers. So that's another avenue or space you can work in. Yeah.
Sorry, Rima, I was just going to add there that that's a really good space to look for specific places that are about if you have a specific interest because of your background and experiences. So I've been involved, for example, with CP Achieve, which is Cerebral Palsy Achieve, which is a national research alliance, and they have consumers, they have a newsletter you can get, which has a number of opportunities for consumers to contribute to their strategy and progress, but also to individual research projects that they're running about all types of cerebral palsy, particularly focused on young people. So that's kind of another way that you can go, well, I'm really interested in maternal health, or my child has this particular condition, or I've got all of these experiences about heart care. If you go to a lot of these places, they'll often have a newsletter you can sign up for, and we'll send out information about national projects. And now with Zoom, I mean, I often have conversations with researchers from all over Australia, so it's not limited just to people who you can get to in Queensland. So that's been really good and interesting way to develop and contribute something from our experience of having kind of a very particular type of condition. And our family, for example, were involved with Epilepsy Queensland for a long time too. So sometimes these are state groups, sometimes they're research groups, sometimes they're kind of national awareness raising groups. And it's a really good spot to look for things that really match with what you're interested in. So.
Thank you.
Fantastic. So I think we've pretty much covered a lot of the slides. Maybe this very last one is around, go back here. And I think we've covered this also, that there's different ways of getting care. I think Michelle talked about, when you go to the hospital, part of it is paid by the Medicare. So think about when you go to your GP, some GPs bulk bill, which means Medicare covers for the whole thing. And sometimes there's a gap payment, which is what you would pay. So then Medicare covers for part of it. So so there's different ways of receiving care. So the GP one can be part or fully funded by the Medicare benefit scheme. With Aboriginal and Torres Strait Islander community controlled health services, that's another interesting model of tailoring healthcare to community group needs that work well for them. So it's often primary health care provided, and it's community owned and controlled. Community care can be provided by a range of different organizations and different funding models. So really depends. Like if you think about a lot of the refugee and resettlement units, health organizations, they run quite differently as well. I do some part-time work for another organization called World Wellness Group, and they do a lot of work for refugees and people who don't have any access to any healthcare. So they look after people who fall through all the gaps. They don't fit into Medicare, they don't fit into state, they don't have a green card that says Medicare with their name and number 1 or 2 next to their name. So where do they go? So there are other organizations that have put their hand up, and they, jump into the race of bidding for funding, and then they provide services for organizations like that. And then of course there's the public hospitals funded by state government. And then side note, like Michelle mentioned, that, parts of it are paid by Medicare within it. Then you have private hospitals, so like St. Vincent's Hospital and various other hospitals, and they might be for profit or not for profit as well. Yeah. And then this lovely diagram, it's a pre-COVID diagram, so it's not very COVID safe, but I want to leave you with this diagram saying our health system is complex, right? We agree? It's complex, it has many parts. The main purpose of it is to provide services to people for their health. So we either call it healthcare or health services. And as consumer representatives, when you get involved in any of these levels, and you can get involved in any of these levels, and you influence the way that care is delivered. So what happens is your experience becomes your knowledge to improve, create systems improvement. And you start where you feel confident. Michelle said this earlier as well. You know, you start where you feel comfortable and confident, and understand what is your level of influence as well. So see what fits right for you, and go from there. Yeah. I'll just stop sharing my screen. Bring you all back here. So yeah, we want to now just open up for questions and comments, so that if there are things that didn't make sense, we're happy to try to go over it again. Everybody jump in together.
Hey Rima, it's Sandra. That was really interesting and informative. And given that I also I work in the aged care sector and have worked in hospital, even for me, the information that you generate, I'm sitting here thinking, gosh, anybody that works inside the business of healthcare needs to do a session similar to this to fully understand, you know, all the intersecting parts and the bits that, you know, that go really well and the bits that can go wrong and the bits that each of us can influence. So thank you. It was really, really useful.
I completely acknowledge what you've said, Sandra. I worked for Children's Health Queensland for a little while, and nowhere during my orientation to the hospital system was I shown any of these, and did not know where I fitted in. And eventually later on, I did say to my manager, I said, can you just draw me a picture? Where do I fit in? And he actually drew me the health system picture, and it was really, really useful. Really, really useful.
I think
to contextualize it.
Sorry, Rima.
Go ahead.
I was just going to say, Sandra, I think you've really touched on one of the key other areas that has a big role in healthcare, that is the aged care sector, and the other one is the NDIS. And it's such an artificial divide to say that aged care and disability care is somehow separate from healthcare, and yet our government manages to do it. But part of that is about how it's paid for. But I just think that those are two areas too where there's a real appetite for getting consumers involved, if that's where your interest is. And there's all kinds of things from local to state to national groups that are interested in talking about the intersection between health, disability, aged care. Mental health care is one of those that can be a little bit off to one side as well. I'm sure, as many of us know, that funding for mental health care is pretty poor and quite recent. And yeah, it's just, there's a lot of work to be done there, I think, from sharing people's experiences. And having a voice in all of this, whether it's your local group or whether it's on a national thing, it's just really important. I'm super passionate about it.
And I think, you know, depending on your area of interest or health journey you're navigating, and Tanya, thank you for sharing. You know, I'm thinking of another consumer representative who was part of our consumer advisory group, and he wouldn't mind I mention his name because he's done amazing work. His son, Gary Hondow's son, so Gary lives in rural remote Queensland, and his son was born with a rare genetic disorder, and he couldn't get the help and support he needed because it was rare. There wasn't a lot of research done. And so what he did, and so this is what happens. There's another consumer who's done a very similar thing where they went out international. They didn't stop at the borders of our nation or our state. They went out international, and they found other people doing research in this space. And what they ended up doing was educating the clinicians at Children's Health about the research, and they were able to bring some cutting edge research into our state even before the health clinicians had thought of doing so. It took the initiative of a carer to go out, do the research, bring it in. And so motivated consumers make a huge difference to the health system. So now at Children's Health, what I don't remember the name of the condition, but there is resource and support around it because someone went out and did some of that work. Yeah. Kate, you want to say something? Sangeeta, after that? You went off mute.
I did. Actually, I had a comment from a way back, just to say about the complexity and the way health workers should do an overview like the one we've just done, because it is so useful. I think as consumers and consumer reps, we often assume that health services do, like people within health services do have an understanding of the system and they do know how the parts connect, and that they can provide that information to us. But what I've learned from being a consumer representative is often actually when you've been doing that work for a while, you get quite a good overview. Like you never feel like you know everything because it's always more complex and fragmented than you think. But you start to join some dots and then you realise that a lot of people working within the system actually don't have those understandings and perhaps don't have those, the ability to connect things for you as a consumer using services that you might assume that they would. And so it's one of the kind of assumptions that I had before I did this work, that people within the system understand it, but actually a lot of them don't, and that's not necessarily their fault. But yeah.
Okay, that's a really great point. And imagine if that staff member who you're working with, and maybe they've been in that role for 10 years, then we would expect them to know it. And it would be really, like, it would be hard for them to come and attend a session like this because the expectation is that they would know it. And so this is a very classic example of where consumers, when they ask questions or explain things or ask for explanations of things, it actually ends up educating everybody around them, because sometimes it's really hard for health staff to ask for what does that acronym mean? Yeah. You know, they might have been using it for 2 years.
Yeah. That's exactly it, isn't it? That, you know, once you're in a role and you've been there a little while, you feel like you can't acknowledge that you don't know something. And so it's really helpful, like for the consumer representative, to be able to say, hey, I don't understand how this connects to that, or I don't understand what this means. And then, you know, half the people around the table are thinking, oh, thank goodness they said that. You know, I don't understand it either, but I can't be the one to say that. So, you know, it's kind of, it's a good role, but yeah.
Yeah, so we're almost out of time. So we're going to go to Sangeeta, Tanya, and then Tanya Carroll, and then Michelle, throw in some words, squeeze her in somewhere too. Sangeeta, did you have your hand up?
I did, but I just want to say a big thank you, because it's beginning to connect the dots for me. It is so much to learn. I just came in this field to do some good work, and I don't want anybody to be as lost as I was when I started, but like, it's still a lot to learn, but connecting the dots. So thank you.
No worries. It's our pleasure. I'm really glad because I spent a lot of time this afternoon getting extra diagrams, and I'm actually really glad I did it because I can see it was really useful for everybody. So I'm going to pat myself on the back. and then Tanya Carroll, and Michelle, if you want to add anything there as well at the end. Go ahead, Tanya.
Hi, Rima. It's been a long time since I was directly involved. I had been on the consumer group with maternity 2016, forever ago. But I've taken on some new things with Connected Beginnings and received funding with our 0 to 5 year olds up here in Mackay. And with our change of hospital situation, the obstetrics have still going through quite an intensive search of information. But I'm wondering if there is that support from Health Consumers Queensland for as far as gaining Indigenous perspective. Like, I know there are other organisations, and I know within the hospital they have people that look for the Indigenous perspective. But to health consumers, Queensland got like somebody that can help moderate, mediate those sorts of situations, or give me more information on how to go about it?
Yeah, so I think that, we don't have any Indigenous staff members. I think that the expertise needs to come from a First Nations person. But in terms of hearing the voices of what's happening at the grassroots level, we run a lot of, there's a very specific consumer, okay, guys, you might want to write this down, specific consumer engagement methodology called KTDs, as we love to use acronyms, kitchen table discussions. So this is a really fantastic methodology, which is used to, we support, train, and encourage people, community leaders, to host kitchen tables. So in fact, in the version of that in the First Nations community is called yarning circles. So we basically make it completely tailored to the community group. And so there's a lot of work happening in and around the equity. So every, and I'm gonna, the names are starting to come. What is that called, Michelle? The equity, I'm just trying to look it up for you. So currently there's a lot of work happening in the implementation of oversight committees in growing deadly families. So growing deadly families, yeah.
Yep.
So there's committees in that sort of space. There's also a lot of work happening with the path to treaty journey and process here, where Queensland government are starting to involve community leaders and how they're being guided by the First Nations people and the government departments working alongside them. I don't have a huge oversight of it, but Melissa Fox, who is our CEO, is actually very aligned and involved in that space of work. So I'm sure you know her. And if you need to get in touch with her, I mean, you both worked in maternity together. Their initial work was maternity also. So should be able to bring you up to speed on that space. Yep.
Wonderful. Thank you. Thanks.